Yes, so if you have read and understood, considering its surgical anatomy station, kindly tell me which organ are you looking at? If you can identify the structure,
Axillary region,
axilla of the which side would you be able to guess?
the right side.
Right side, very good. Can you tell me, all right, if you can identify structure A?
Is the biceps
Biceps brachii. Okay.
biceps?
Can you identify structure B?
This is radial nerve. Then it
Radial?
should be sorry, median nerve. Median nerve.
Okay, good. And C,
Ulnar nerve.
if you can identify D, E, and F.
D is axillary nerve. E is musculocutaneous nerve. F is radial nerve.
This structure that you're looking at, from which view can it be possible to have a look?
It from posterior side,
Behind the clavicle bone, right?
behind the clavicle.
Yes. Okay. If you can tell me, these structures, they have a specific name. Can you tell me what that is?
Which structure, ma'am? This nerve?
Yes, all these which you
All
can
this
see.
forms the brachial plexus.
Brachial plexus. Can you tell me how brachial plexus are formed?
Brachial plexus are formed by the anterior rami of root from C5, cervical 5, 6, 7, 8, and thoracic 1.
First one, okay. Would you be able to tell me the surface anatomy of the brachial plexus on a living body or living human being?
Is there is it is divided into root, uh, division, trunk, and
Roots, trunks, division,
roots,
cords.
trunks, division,
Yes, and then cords and then branches. Okay,
branches.
but I want you to tell me the
And the
surface anatomy. Like if
roots,
you are given a pen and a human body or human being, a patient, a prosection or something, and you are asked to draw on it, how would you do it?
the roots would be on the scalene anterior. Yes, the roots will be on the scalene anterior muscle. Behind the scalene anterior muscle,
Yes.
and the uh, trunks would be on the with the subclavian artery, behind third part of the subclavian artery. Then there will be divisions which will go behind the clavicle, the one third of middle one third of the clavicle,
Yes. And the
and the cords
be the one.
will be with related to the axillary artery, the
Okay,
second part
very
of the
good.
axillary artery.
All right. Okay. Can you please tell me what are the nerves or what are the branches which arise from the roots? Or
Roots
what are
arise
the
from the
nerves, yes, which arise from the roots?
lateral scapular artery and
No,
dorsal scapular artery,
dorsal scapular
lat-
nerve and long thoracic.
long thoracic nerve and dorsal
Yes.
scapular nerve.
Okay. And there is another third one as well, nerve to subclavius. So 3 from the roots. How many nerves arise from trunks?
And from the trunks, there is a
None.
suprascapular nerve and
None.
nerve to subclavius. The nerve
None.
to subclavius is from
None.
no, there are suprascapular
Not from the
trunk. There are,
trunks. Roots and okay, there is one. Okay,
yeah, the suprascapular nerve is from.
but I think it's from the divisions. I don't think it's from the. Okay. Can you tell me what are the parts of the brachial plexus? You told me the parts, okay, and where? Okay, what are the branches of the brachial plexus? If you can please tell me.
Is from the roots. There are 3: the nerve to subclavius, dorsal scapular nerve, and long thoracic nerve. From the trunk, there is one. There is suprascapular nerve. From the cord. There from the divisions there are no branches. From the cords there are three cords: medial cord, lateral cord, and posterior cord. And from the lateral cord there are lateral cutaneous nerve of the arm, musculocutaneous nerve, and lateral pectoral nerve, and lateral root
Okay.
of median nerve. And
Okay.
from the medial cord there is medial root of median nerve, and there is ulnar nerve from the medial cord, and
The
from the posterior, yeah,
yes. How
from the
these cords are named? Can you tell me?
these are names named the muscle, uh,
No.
no, artery, the axillary artery.
Yes. As they are related to the axillary artery.
Yes,
Second part of it.
second
So
part of
can
it.
you, yes, can you please tell me if, yes, if there is an injury to the brachial plexus, so what are the types of injuries that you can expect
Yes,
with
there are
regard to brachial plexus?
yes, there is mainly two injuries: arms paralysis and
Yes,
plummet paralysis. Arms
yes,
paralysis due to the upper root C8,
C56, C56.
C56,
Yes.
C56 upper part, and plumpness are due to the lower part. The
Okay, a
C8
patient presents with Erb's paralysis. What would be the motor and sensory loss that you'll see on the patient?
nerves paralysis. There will be Potter's Tipper's position. The
Okay,
motors, the arm will be adducted. That is loss of the deltoid function,
yes,
and so the uh, forearm will be pronated, so there will be loss of supination, uh, supinator,
yes,
and the hand will be flexed. So there will be paralysis of the flexors, sorry, extensors. So the hand will be flexed, arm will be
and
adducted,
sensory.
and forearm will be. And sensory, there will be loss of sensation over the badge area. There's lower part of the deltoid area.
Can you tell me how this Erb's paralysis takes place or how it occurs?
So it can occur in shoulder dystocia. There's pulling of the shoulder during birth.
Okay. Uh, Contrary to that, how the clumping paralysis takes place?
It fall on the outer stress hand.
Okay. Just like a person falling down trying to reach out for a tree grant. Okay. How this patient presents with clumping paralysis?
Plumkies will be there is claw hand. The C8 and T1 from the ulnar nerve.
Yes,
So there will
yes.
be paralysis of this ulnar nerve.
And there'll be
Intrinsic
paralysis of
muscles of the
hand,
sorry,
intrinsic muscles of the hand.
yes, intrinsic muscles of the hand, and there will be hyperextension of the metacarpophalangeal joint and
Yes.
flexion of the uh, interphalangeal joints.
And there'll be what type
And
of sensory loss would there be?
sensory loss will be on the ulnar side of the arm and forearm
Very good.
and hand.
Okay. Yes. All right. Good. Thank you.
Thank you, ma'am.